Hey guys, this is Manu, Kalia, physical therapist and Ayurveda herbalist. I wanted to answer another question today, which was which a lot of my patients as well as clients and some of you have asked me also that how do I recover faster? Whether after an injury or if I'm training, how can I recover faster? How do I improve my strength or endurance, right? Or if I'm recovering after a specific injury, my knee is injured, and how can I get my knee better faster? What exercises can I do? What can I do to get better quickly so I can get back to my specific athletic activity? So I always tell my patients, and this I think is very important, and I think most people tend to forget that remember exercise or certain forms of physical activity, though they're very important, that is one component, one part of the whole thing. Okay, so which means that that is important. However, all the other things that need to also happen in order for you to recover faster, whether after an injury or if you're training for things, also need to be in place. Okay, so things like getting adequate amount of sleep and rest is essential. You can exercise all you want, but if you don't get adequate amount of sleep and rest, you will not recover. Okay, and that goes for after injuries also. Okay, because in fact, if you're exercising or over training, you end up overtraining. And on the other hand, if you're injured and you're trying to do rehab or specific types of recovery after an injury, you won't have enough reserves. Your system won't have enough reserves or rest to help the recovery process take place. So rest is extremely important, and with that, relaxation or stress management. If I have my stress levels are extremely high, I'm going to always have a much harder time getting that recovery from taking place, or it'll delay the whole recovery process. And I see this guys all the time in my practice. And I would say, 8, 9 out of 10 times patients come and in addition to the injury that's taken place, if it was an acute injury, for example, injuring your back while bending and picking up something, or for that matter, let's say somebody's had a chronic condition going on, where stuff has just built up over time. They started having a disc-related problem in the neck with radiating symptoms down the arm. Um, you know, Stress plays a major role in helping or preventing the healing process from taking place, okay, or delaying the whole healing process. So it's very important, the stress management and relaxation component also, okay. Um, and remember, your goal has to be to work towards being in your parasympathetic mode. That's your relaxation, healing, recovery system, not in your sympathetic or fight or flight mode all the time. Okay, that's your go, 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 get stuff done, that mode. Okay, so you burn yourself out if you're constantly in that mode. You want to preserve your chi, your reserves of your system. Okay, so if you have more reserves, you're gonna help that healing process take place faster. Okay, of course, nutrition and diet is a major component. I have patients come in and they say, well, I've been doing all the exercises, everything I did, and then suddenly last 2 week, even though I'm doing the same things, I'm having more pain now. Right? So you really have to evaluate and see, okay, if the activity level and the amount of stress and all the other components are the same, what else is there that's causing that pain or the symptoms to change? So remember, diet plays a major role also in this. So that could be impacting or influencing whatever the person's eating, right? Can be influencing and impacting what's happening within the system that's causing more problems for that tissue, okay? So it's not just for your other organs that eating crappy is bad for the heart or your liver and other tissues. I mean, uh, your bones and your joints are also part of the same system. It impacts those systems also. So think about it from that perspective. Okay, so nutrition is a very important component of that recovery process too. So you have sleep, you have relaxation, you have nutrition, then of course we talked about exercise. Remember, adequate amount of exercise depending on the condition, the injury, or the problem that you're facing. Okay, not excess, not too little, and so just the appropriate amount. And this has to be, a lot of times people need some guidance on, okay, because they don't know. You don't want to overtrain or overdo it. You don't want to undertrain and cause a deconditioning, an atrophy of the tissue either. Okay, so all these things have to be weighed in. Okay, and the other part that I think is very important is your mental attitude. Okay, this is extremely important. Probably, in some ways, probably the most important factor, I would even say. Okay, a positive attitude, a mental attitude that the tissue, you are going to recover, the tissue is going to get better, you will heal. Essential. Okay, so not to get stuck in that pain cycle. Oh, it hurts, it hurts, it hurts. You're constantly giving input to your system, to your nervous system, to your brain, that tissue hurts. Your focus is constantly there. So positive attitude has to be there. Remember, what you think, your thoughts will affect the rest of your system also. Okay, for the healing process as well as recovery. Okay, so keep in mind that all of these other systems all the other things are as essential as just exercising, or that there's no one thing. So you have to do all these other things also to improve the optimal functioning of your system for recovery and healing, and especially after an injury. But definitely, if you want to, if you're training for sports or something else too. Okay. And I think a lot of people forget this. And as I said, I have lots of patients that come in, and one of the major things I started looking into when I started digging and asking questions is that, okay, besides the exercise and all the other things you're doing, what else is going on in your life? Right? That might be delaying or preventing that recovery process from taking place. We get so fixated. Well, you're doing your X number of reps, you're doing this, you're doing this, and you're doing this. Well, it's not getting better. But most people don't dig in further and figure out what else is going on in this person's life. For example, I have a patient comes in, and I have patients coming in who had just had a knee surgery, and the person also has cardiac problems, and they have diabetes, they might have some other issues going on. So now remember, your reserves are limited, finite. Reserves, your chi, your resilience of your system. Okay? So if they are dealing with these other diseases or problems like cardiac problems or diabetes and other things, and then you have this surgery, knee surgery you're healing from, so your reserves are diverted toward these other things, and now you're asking the system to take care of this knee also. So you got to look at it from a different perspective, not just get narrow-minded and say, oh, well, it's just, I'm just working on the knee, I'm exercising, but it's not getting better. Look at the rest of the system. What's going on in the system? What other things do I need to address and change, and for that knee to work better? And quite very often, majority of the time, that I find that you address a lot of those other components, you don't need to even exercise as much quite often, and the body will do its job. You just have to do the right amount of stuff. Okay. So I hope you find that useful and helpful, and it answers some people's questions as to why they're not getting better and what's slowing down the process. Okay. And as I said, if you have any questions, leave a comment. Make sure to subscribe to the channel, and thank you.